le duele.
Tell him to keep still. I'm right on the nerve.
She says don't move. She's on the nerve, babe.
Suction, please.
Gotcha.
I just got back from the dentist, and I hope that now, I sound a little bit clearer in terms of speaking, now that teeth are not rattling around. And of course, all of this was caused by a severe addiction to sugar, which I have had to give up thousands of dollars later and recurring health problems later. Well, I'm in the dentist's office, and the dentist says he's fitting a zirconian bridge into my mouth on the upper plate, and he's putting it in there, and so, but the whole thing basically is being conducted in Spanish, and he doesn't speak Portuguese, so we, aren't going to conduct this in Portuguese. So it's Spanish. So he says, grind your teeth. But he says, grind your teeth in Spanish. Well, that's kind of like molillar los dientes. But to grind in Portuguese, Spanish, French, Italian, Latin, Greek, it is a very, very difficult word. So in this particular case, he used the English word, grind your teeth. Now, he's a dentist, not a linguist. So he wouldn't know necessarily that to grind is a very, very complicated word. And because it is a technology word, anytime you deal with a technology, you are always going to have differences, radical differences in translations, because it's not just naming a thing. Like you look at a bird, and you can call it an ave, you can call it a pájaro, because it's a bird. It's an actual object. But when you have to name an action, to grind, then you say grind what? Are you going to grind diamonds? Are you going to grind wheat? Are you going to grind corn? And it gets really, really complicated as you move across the linguistic spectrum. But, so I'm going to look up all of the various ways that you say grind your teeth. And so the dentist and I were not without hiccups, but you had the dentist, you had the dental assistant, and I were in the room. And all of a sudden I hear someone speaking English. So I asked the dentist, I said, now hold on. And this is in Spanish. I'm asking the dentist, I'm asking, what's going on down there? And I said, so I asked the dentist, I said, I hear somebody speaking English down there. So he said, yeah, there's somebody speaking English down there. And I said, so is it a translator down there? And so, because I hear somebody speaking Spanish, or two people speaking Spanish, kinda, and some guy speaking really, really loud English. And so I asked the dentist, I said, hey, you know what? I've got to see this. This is one of those YouTube moments. This is a YouTube story. Because this is a know before you go story. So the dentist and I sneak down there. Because, I mean, he's in a practice, but I think the other dentist is in a co-practice. They share the same building. So they're not necessarily partners in the same practice. So he doesn't really want to go down there and embarrass the patient, the translator, and the dentist. So we get down there and I look in, and it's an Americano 100%. He weighs about 490 pounds. And here's the dentist. She's got a body mass index maybe at 29. And here's somebody in like a gray, she's in a gray dental uniform, and she's just standing there looking at what's going on. And I don't know if there was a fourth person in the room because it had to be a dental assistant. And so maybe there's a fourth person in the room. And the English speaker, and okay, the little lady in the gray, she had a body mass index of maybe 21 or 22. So here's this big American guy, and he's taking up basically the whole room. And I mean, and he is so enormous that the poor little female dentist has to reach across his midsection to get into his mouth. So she's basically like standing, she's leaning on the guy's stomach. He's so big. I mean, this is awkward. You got one person speaking Spanish, one person speaking English. One person speaking English, and you got the dentist giving instructions to the dental assistant, and they're naming things, like pass me this instrument, pass me that instrument. How do you feel? I mean, it's just so. My dentist, he pulls me back, and we're both basically, like two schoolboys. We're basically giggling. My dentist and I, we're real cool. He runs, he works out. He's a real cool guy. He's same age as I am, same generation, same thoughts, listen to the same music, except, he doesn't, like listen to música popular de Brazil. He doesn't know Fauno or stuff like that, but he isn't into norteños either. So we're kind of like giggling about it, and like two schoolboys, and nobody gets embarrassed. The American patient doesn't see what's going on. The translator doesn't see what goes on. The dentist, she's leaning on the patient, and her back is to us, so she doesn't see what's going on either. And the only person that can see us looking through the door is the little dental assistant, the little the pretty dental assistant. And so we go back towards his towards the rooms of his practice, and we go back over there, and he says, "You know what? I'm going on vacation to Miami. So there's one more tooth that you really need some treatment on. So come back on the 8th, and we're gonna get that tooth squared away also." And so I'm trying to get all of this fixed because I don't want sepsis to set in. And also, the most important thing is that if you lose any dentation, you're going to lose bone that disfigures your face. And also, it changes the microbiology in your mouth. And when that microbiology changes due to a loss of dentation, there can be harmful bacteria, harmful microbes that come into your mouth, go into your airways, go into your lungs, and cause a pneumonic condition. So that's one of the reasons that people that are old like me, that's one of the reasons that we can die rapidly of a pneumonic condition, and pneumonic complications, because when you sleep and you don't have proper dentation, all of these foreign microbes can go down into the lungs and thus complicate your situation. So you want to get any lack of dentation fix X post facto. Now, go to ChatGPT and or the AI of your choice and put in what are the problems that are caused from lack of dentation. It's best if you look at it in French because the French do an absolutely excellent job on the topic. But you can look at it in English also, and it's going to get you in the dental seat quicker than you possibly can believe and alter your eating habits. So there are very good reasons to alter your eating habits that have nothing to do with aesthetics, that have everything to do with staying alive. Well, the dentist and I were walking back, and he says, well, I asked him, I said, hey, do you treat English patients? Now, this is in Spanish. I said, now, do you treat English patients? And then there's you in there, there's the dental assistant in there, there's the patient and the translator. I said, so do you have all of these people in the room with you also? And he has some English, so he said, but he's telling the story in Spanish. He said, well, no, not really. I really don't have all of those people in there. He said, but I'll tell you this much. He says, my neighbors are Persian, and they rely on me for their dental work. And he says, so they come in, and for example, he says, abre tu boca. He says the word abre tu boca, and he says it in Persian. And so then I tease the dentist, and I say to him, I said, tú sabes más que charmuta. And he says, charmuta? He said, and so he says, is that a bad word? I'm like, yeah. So in Arab, Persian, everybody learns like sharmuta first. Everybody that has had any contact is going to know habibi, which is a good word, and they're going to know sharmuta. So, here's the thing. Once again, know before you go. What was a 400 to 500-pound American guy doing sitting in that dentist's office, getting a life-altering treatment, and he had no English? No Spanish. Now, guaranteed he was going to save a few bucks. That's guaranteed. He was going to save a few bucks. But did he really think about it? He could have, rather than trying to save a few bucks in Mexico, he could have flew to England and saved a few bucks. He could have flew to the Philippines and saved a few bucks. And he could have had a nice vacation in England or in the Philippines and saved a few bucks there, and understood everything that the Filipino dentist or that the British dentist was saying to him. He could have even went to Canada and saved a few bucks. So it's not just about getting the bottom basement price. And you see it all the time. Okay, and remember the story. Some Americans go to Matamoros, right across from Brownsville. Go to Matamoros. Get into Matamoros, they go to the dentist. They travel all the way from North Carolina, South Carolina, wherever they came from, and they're going to get themselves some cosmetic surgery. I don't know, tummy tuck, butt lift, who knows. And they get down there, they don't understand what's going on. The cartel down there are looking for some people that may look like them. Cartel lights up their car, kills some of them, takes them hostage. FBI, U.S. government gets involved, goes in, cavalry comes, rescues those which were not dead. But they could not talk to the cartel people, and the cartel people addressed them before they started firing. They could not respond. So it was just a pure, absolute accident. So what you have to ask yourself is was it worth it trying to save a couple bucks on cosmetic surgery? Was it worth it? They did not know, but they went anyway. And not that everyone who does not know but still goes, not that everyone is going to get into an awful situation and lose their life or lose a limb or lose their way. Not that that's going to be the case. But just as this guy, the 500-pound guy in the dental chair, 4 people in the dental office, the dentist, the 500-pound guy, somebody translating, and the dental assistant. And so the dentist, my dentist, concludes this. I said, well, who's the translator? And he says, possiblemente la novia. Now, are you getting this? So, posiblemente la novia? So he has, and this must be routine. So this guy is getting a technical service performed where the translator should have technical expertise. And he most likely is having la novia is la traductora. Now what you're going to say is well, you and your dentist, you're both talking Spanish, and you don't have any technical expertise in dentistry. And a Mexican patient comes in and they don't have any technical expertise in dentistry. Or at an American dental place, the dentist and the American are both speaking English and there's no technical expertise. Well, why on earth, except for when I was a teenager, why on earth would I go to the dentist and not address technical questions? So when I went to the dentist, all of the things that he had to say and I had to say were about the technical practice of dentistry. That doesn't mean that the patient has to be a dentist, but it does mean that the patient has to be aware of dentistry and of the nomenclature. So what was this 500-pound guy doing in there? No Spanish, no technical jargon, no nomenclature, and probably his girlfriend translating. That's a dangerous situation just to save a couple bucks. Know before you go.
Dice que le duele.
Tell him to keep still. I'm right on the nerve.
She says don't move. She's on the nerve, babe.
Suction, please.
Gotcha.